Meantime, from China to Italy, the biggest challenge for fighting COVID-19, you could say, comes down to one word: capacity.
You can have the greatest hospitals in the world, but that doesn't help if you can't get into them. Fox 13's Max Roth joins us with that story. Max.
Yeah, Bob and Amy, I am going to ask you to remember two numbers, and you'll see why as we get into the story a little later. 12 and 4. South Korea has more than 12 hospital beds for every 1,000 residents. China has more than 4. It is a question of capacity.
Dr. Michael Good of the University of Utah says hospitals can handle seasonal flu because of long-built immunity, vaccines, and effective antiviral drugs.
Think of that as a slow wave. We're able to take care of everyone.
If a Utah hospital is this boat, it can ride that flu wave.
Coronavirus is a new organism. We haven't seen it before. And so we do not have immunity in our individuals and in communities. Communities that do not prepare get hit by a tsunami.
The tsunami will swamp the boat, the hospital. National reports have made clear Michael Good is expressing the #1 public health concern for COVID-19: hospitals, specifically ICUs and ventilator capacity. The Kaiser Family Foundation shows Utah has 1.8 hospital beds for every 1,000 residents. Some western states do just as poorly, but Utah is far below the national average of 2.4 beds per 1,000. Utah does have fewer senior citizens than most states, possibly helping the situation. Even so, if a quarter of Utahns were infected and 1 in 10 of them needed hospitalization, that would mean 5 COVID-19 cases for every bed. Actually, though, most of those beds are already taken, making the demand too much. That's the tsunami we can all flatten if we follow public health guidelines.
So they have 6 times as many hospital beds per person or per capita in South Korea as we do in Utah, more than twice as many in China. Even Italy has quite a few more hospital beds per capita than we do in Utah. So at today's press conference with the governor, Dr. Kurt Hagman was there from the University of Utah, and he made a point to say getting the public to comply is more important than anything doctors can do. That keeps the numbers low enough for Utah's great hospitals to help everybody who needs them. Live in studio, Max Roth, Fox 13 News, Utah.
Thank you, Max. And if you at home have questions or concerns about COVID-19 here in Utah, you can call the state hotline. That number there on your screen, it is 1-800-456-7707.
You can find many other resources and stories about COVID-19 on our website, fox13now.com. There's a new navigation tab at the top of the page, which will take you directly to a case tracker map, Utah Department of Health updates, and ways to stop the spread.